Hey everyone, it's Dr. Ty at East Valley Chiropractic. I have my special guests here, Dr. Beth and Jill from Achieve Health and Wellness. So we wanted to get on here and talk to you guys today about kind of pediatric specific chiropractic, PT, and OT. Like I said, our whole goal with bringing these two lovely ladies on is just to give you guys resources, let you know that they're available to help you and to complement what you're receiving here and give you more resources. So where I want to kind of start is, I want to start with Jill. Jill is the occupational therapist over there at Achieve Health and Wellness. And so I want to talk about specifically pediatrics. A lot of people may have heard of OT, but don't know that there's really like a high demand or a need for pediatric OT. So Jill, kind of explain a little bit of what you do with your pediatric patients.
Absolutely. So at Achieve Health and Wellness, part of my focus is working with kids who not only have neurological disorders, but kids who are on the autism spectrum, who have maybe ADHD. They could just have behavioral difficulties, and then one of the other disorders that I see is sensory processing disorder. So, and a lot of times that runs along with kids who also have autism. Some kids who have autism or ADHD also have difficulties with sensory processing, and what that looks like is in our brain, a typically functioning brain processes sensory stimulus from the environment. It's constantly intaking information and constantly giving responses to that sensory information. And so in kids, if they are not regulating sensory information, that can come out in a lot of different ways. They could seek a lot of sensory input, so banging into things, crashing into things, having emotional outbursts, behavioral disturbances, all because their brains are not regulating sensory information. And so that's a big niche area that I work with kids on, is bringing in that sensory regulation piece so that they can function within their environments.
Right. And so why is it that, kids that have that sensory processing disorder, why is it that they're seeking those senses? Because like you had talked about, it could be like a physical thing, like you see kids that are hitting or kind of really want to gain that physical aspect, but it also has included things like eating, right? Because there's a sensory piece to like eating and those other things, right?
Yes, there are so many different things that it can manifest in. It could be difficulties with food intake because there's issues orally. There could be auditory processing, visual, tactile defensiveness, which is, different textures, clothing could bother kids. It could be gravitational insecurities. So any sort of change in elevation could bring about difficulties with mobility. It could be avoiding sensory input altogether because it's alarming and they're very sensitive. So it can really manifest in a lot of different ways.
Right.
Yeah.
So those sensory things, a lot of times if there are troubles with, gaining those senses, you're seeing that as behavioral kind of, I don't want to say lashing out, but a lot of times those sensory issues come out as behavioral issues. And you can see with what Jill was saying is there's such a wide range, a lot of things to really navigate, a lot of information to take in to really figure out, okay, where or what path do I necessarily need to go down with this individual kiddo? Because as we all know, we're all individuals, we're all different. So, two kids could be completely different as far as what you're seeing and what the goals are that you're trying to achieve with them. Because that's the big thing, right, is you want to figure out what are these sensory concerns that are going on that are coming out as behavioral things, but then so when you kind of identify that thing that you need to work on clinically, how does that translate then into the goals and the functionality that you want to achieve with those patients?
Yeah, and so the behaviors, like you said, those are kind of like our markers, our indicators, the red flags. So we do rely heavily on the parents and the teachers to tell us what those behaviors are, because a lot of times there is something that's underlying neurologically that are bringing about those behaviors. So and then with goal setting in terms of function, again, relying heavily on the parents to figure out, where are those behavioral disturbances and those difficulties with sensory processing causing an impact in their overall function. At school, it could be that they're just having difficulty sitting for 8 hours a day. They cannot tolerate, sitting still in a classroom. And so if that were the case, we might look at incorporating movement breaks, brain breaks. We incorporate a sensory diet based on those behaviors. So we give our parents a home program, if they are having difficulty with seeking too much input, and if that's crashing into things too much or always rubbing up against other people because they're seeking that sensory input. Part of that is giving the parents a sensory diet and at-home program with activities that they can do that really taps into those sensory difficulties so that they can get regulated at home and then at school, and then their performance improves drastically in all of their areas.
Absolutely. And you were saying a lot about like movement breaks, the example you kind of gives with kids of movement breaks at school or at home or things like that. I would imagine, Dr. Beth, that's where you come in and where the collaboration works so well with OT and PT and vice versa, is the movement breaks and giving the kids and that physical aspect of it. Is that correct?
Yep. Yeah, especially for individuals, the kids with like spectrum disorder diagnoses and the sensory processing. A lot of times as physical therapists will really focus on like balance and coordination, because a lot of times those kids don't have a very good sense of like where their body is in space, poor body awareness. And we a lot of times will also make we call it a heavy work program for the kids to give them some of that like deep, heavy input that they need.
And that heavy, I'm familiar with that term, the heavy therapy essentially. That'd be something as simple as like, pushing like a heavy box or anything that's really heavy, but it really requires a lot of energy, so to say, but it's giving that stimulation of proprioception, like you said, just kind of that awareness in space of where your body is, and that it helps them improve significantly with that. And so, no, that's great. And the big thing with chiropractic too, and how we all would work wonderfully together is, we're working specifically with the spine, and there's a lot of proprioceptive, that body awareness input that comes from the spine, not only the muscles, but also the joints within the spine as well. So there isn't necessarily one of the three that you would want to pick over the other. It's really a collaborative effort because all three professionals have kind of their individual things that can benefit the patient, and really that's the goal. I mean, that's our our first and foremost goal is to do what's right for the patient, and so that's wonderful. And so if you guys have any questions for Jill or for Dr. Beth or for myself, and how our services can benefit you guys, or maybe a struggling kiddo that you have at home, or if you're wondering where to turn, we would love to be a resource for you, help you out any way that we can, or point you in the direction. If it's something that is beyond my scope and that'd be more fitting for Jill, or vice versa for Dr. Beth, that's part of our collaboration with the Chief Health and Wellness here in the month of June and really beyond, is to get you guys the answers that you need. So anything else from you ladies at all?
I think that's it.
Awesome. So if you guys have any questions, let us know. Otherwise, thank you so much.